Live, local, late breaking. WPBF 25 News at 9.
Well, this month is Cervical Cancer Awareness Month. Coming up, how you can protect yourself from this very common form of cancer. Well, January is Cervical Cancer Awareness Month, the fourth most common cancer in the world, but it's also one of the most preventable. Here to talk more about screenings and vaccinations is Dr. Thomas Morrissey, who's the Director of Gynecological Oncology at Lynn Cancer Institute. Doctor, thank you so much for being here this morning. Very important. Of course, it's being highlighted this month. So I want to kick things off with a couple of questions. One of which is, how can us women protect ourselves against cervical cancer?
Well, thanks again for having me. Again, like you said, cervical cancer is the fourth most common cancer in the world. There's about 10,000 cases of cervical cancer a year in the United States. It's also one of the most highly preventable and treatable cancers that we have, with cervical cancer screenings and also use of the HPV vaccine. So it's important to get pap smears, and also we can prevent it with the HPV vaccine.
I know in the last couple of years, when it comes to mammograms, pap smears, it's been going back and forth about who should be getting these screenings and how often we should be getting these screenings. So talk about ages and who should be making sure they're getting these annual exams.
Right. So the current recommendations for pap smear screenings, so between age 21 and 29, people should be getting pap smears once every 3 years. And then between ages 30 and 65, you get a pap smear and an HPV test every 5 years. If the HPV test is available, if only the pap smear is available, then they get a pap smear every 3 years.
And I believe, if I'm correct, that's actually changed. For a long time there, it was every year. It was something you were getting at your annual visit. Why has that changed?
Right. So they've found with the advent of the HPV test, which is, we know is one of the causes of cervical cancer, people who their HPV test is negative and their pap smear cells are normal, they're not at higher risk that need to be checked every year. And so we found that people don't need to be checked as often without losing the ability to detect people who are at risk.
And as far as the HPV vaccine, who do you want to get this vaccine and when?
Right. So the HPV vaccine is very, very effective, 99% effective at preventing cancer and precancerous changes. It's recommended for all 11 and 12-year-old girls and boys by the American Association of Pediatrics and Community on Immunization Practices. Again, it's very highly effective, and hopefully we'll be able to significantly reduce the risk of cervical cancer for the whole population, since we're now able to give that vaccine to younger kids.
And you say this is a preventable cancer, getting screening is so important. Are there any warning signs that something just might not feel right or seem right with a woman's body where they need to say to their doctor, I think something's wrong?
Right. So usually heavy bleeding in between periods, or bleeding after exercise or intercourse, or bleeding in someone who's menopausal is always considered abnormal and should be looked at by a physician to evaluate what's going on and make sure people are up to date on their pap smears. And if people are having trouble getting in to get pap smears, either they're uninsured or underserved, the Promise Fund of Florida helps provide cervical cancer screenings and cervical cancer care for uninsured and underserved women through subsidized partnerships with local healthcare providers like Baptist Health and Lynn Cancer Institute. So if patients need help, they can go to promisefundofflorida.org.
And that was going to be my last question. I appreciate it. That's good information. If you don't have insurance, perhaps you're out of a job right now, but these screenings are so important. Reach out to somebody. Somebody will help. They'll point you in the right direction. There's no reason we shouldn't be screened. Thank you so much, doctor. Really good information. And we have more information, more resources on promisefundofflorida.org. Go check it out. It could save your life or someone you love.